Hello, everyone. Today we are going to be taking a closer look at some of the strategies for answering NCLEX questions. And today we are going to be introducing a whole new concept that we have used over time. And our students have found it very, very beneficial, especially when you are considering success on the day that you are taking the NCLEX. So my name is Daniel Ampoma. Let's get going. So first and foremost, let us take a closer look at some of the strategies for answering NCLEX questions. Number one, do not read into the question. Look for strategic words, the use of guidelines for prioritization, positive and negative event options, the need to focus on the subject of the question, eliminate questions that are comparable or alike. Absolutes make answers wrong. We all know that. Look for the umbrella word option. Use guidelines for delegating and assignment making. Psychosocial versus physical need questions. What are the opposites, especially when you find them in an answer? Okay. Sometimes we may say you find them in a question. How do you differentiate them? Visualization as a test-taking strategy, prioritization ordered responses, illustrations and figures, and finally we are looking at graphic item options. So for today, let's take a closer look at the new concept that we have developed over time. And like I said earlier on, we have found it so beneficial. So this is the concept of AND, A-N-D. Now, the concept of AND in the body of the question. So anytime when you have an NCLEX question and you have AND as part of the question, okay, keep in mind that the AND over there is a word that is used to introduce an additional comment or interjection. Please read the question. And when AND is used in the sentence, it always connects two parts of the sentence. You need to identify the second part of the sentence that follows the conjunction AND. Look out for the keywords in that second sentence. Next, pick the answer that is connected to the keywords in the second word sentence. That is what is going to help you reach out directly to what type of answer you are looking for. So, without wasting time, let us take a closer look at our first question. A client with cardiac disease turns on his call light and tells the nurse he is experiencing chest pain. What is the first nursing action? Now, as you take a closer look at this particular question over here, you could see that AND connects the first part of the sentence. That is, a client with cardiac disease turns on his call light. That is the first part of the question. The second part of the question that AND connects to tells the nurse he's experiencing chest pain. So in this regard, the actual question here where you need to zero in has to be the second part of the question. And that is tells the nurse he's experiencing chest pain. And we all understand that when a patient is experiencing chest pain, basically it is the lack of oxygen to the myocardium of the heart. Okay, and if someone is experiencing chest pain, the lack of oxygen. So if you are answering this particular question, you have answers 1, 2, 3, and 4. Go for that which is connected to what? To oxygen. So in this regard, our first answer is going to be begin oxygen what? Administration. Let's take a closer look at the second option. It's another question. He says the nurse is caring for a patient or a client who was involuntarily hospitalized to a mental health unit and is scheduled for electroconvulsive therapy. The nurse notes that an informed consent has not been obtained for the procedure. Based on this information, what is the nurse's best determination in planning what care? Again, take a closer look at the word AND. So AND, as you see it in the sentence, connects the first part of the sentence and the second part. But please zero in on the second part of the sentence where "and" is connected to. That is scheduled for electroconvulsive therapy. The nurse notes that an informed consent has not been obtained for the procedure. You are zeroing in on informed consent. Okay. So in this regard, if you take a closer look, what are you planning towards? What are some of the best determination in planning that? So when we take a closer look over here, our answer is going to be 3. The informed consent needs to be obtained from the client. And when you go back to the question, what does it tell? The second part, it says, the nurse notes that an informed consent has not been obtained. So you are looking for the best word answer that connects the second part of the sentence to the end. Let's take a closer look at the next question. It says the nurse is caring for a client with anorexia nervosa. Which behavior is characteristic of this disorder and reflects anxiety management? So keep in mind that the "and" over here connects the first part of the sentence to the second part of the sentence. But we are focusing more on the second part of the sentence, which says reflects anxiety management, basically with a patient who has anorexia nervosa. Now, when we consider managing anxiety disorder, in the first instance, what do? You need to assess for vital signs. And based upon those indications, you will go ahead and manage the anxiety that the patient might be going through. If we take a closer look at this particular question, your answer over there is going to be what? Number 1, assessment of vital signs is what is needed. Thank you for watching, and we hope you found this beneficial. Thank you.